Hello, and welcome to another episode of MedHeads, your go-to podcast for cutting-edge insights into health and medicine. Today, we're diving into an exciting and innovative approach in cancer treatment that's sparking conversations across the integrative medicine community, targeting the mitochondrial stem cell connection with a hybrid orthomolecular protocol. In this episode, we'll explore the science behind mitochondria's role in cancer, how cancer stem cells contribute to treatment resistance, and why combining orthomolecular strategies might be the next big breakthrough in oncology. Grab your cup of coffee, settle in, and let's navigate this fascinating intersection of cellular energy, stem cell biology, and nutritional medicine. Cancer remains one of the most complex diseases of our time, and while traditional treatments like chemotherapy and radiation have their place, they often face the hurdle of resistant cells. Recent research points to a critical player in this resistance, our cell's powerhouse, the mitochondria. Mitochondria aren't just energy factories, they're also pivotal in regulating cell death and metabolism. When they go awry, they can contribute to the survival of those particularly stubborn cells known as cancer stem cells. These cells have an uncanny ability to repair, renew, and adapt, making them less susceptible to standard therapies. It's almost as if these cells have a built-in survival kit, and understanding the mitochondrial connection might just be the key to dismantling that kit. Now, let's talk about orthomolecular medicine. In simple terms, this approach is all about optimizing the body's biochemistry with the right doses of natural substances. Think vitamins, minerals, and other nutritional compounds to support health and combat disease. But what happens when we combine these principles with targeted mitochondrial therapies? Enter the hybrid orthomolecular protocol. This protocol isn't about replacing conventional treatments, it's about enhancing them. By strategically using nutrients that support mitochondrial health and function, we can potentially undermine the survival tactics of cancer stem cells. Imagine giving these rogue cells the nutritional equivalent of a Trojan horse, one that disrupts their energy production and makes them more vulnerable to conventional therapies. So, why is the mitochondrial stem cell connection so critical? Research suggests that cancer stem cells rely heavily on altered mitochondrial metabolism to survive, proliferate, and even evade the immune system. When the mitochondria in these cells become dysfunctional, it not only changes the cell's energy production, but also its overall behavior. One theory is that by targeting these mitochondrial processes, we can force cancer stem cells out of their survival mode. Compounds like coenzyme Q10, vitamin C, and other antioxidants can help restore or modify mitochondrial function. The goal is to tip the scales, making it harder for cancer stem cells to repair themselves and more likely to succumb to treatments. Now, let's break down how the hybrid orthomolecular protocol is designed to work. First, there's an emphasis on identifying and delivering the right nutritional compounds at the right doses. This means considering not just the standard daily values, but using therapeutic doses tailored to disrupt cancer cell metabolism. For example, high-dose vitamin C has been studied for its pro-oxidant effects in cancer cells, essentially creating an environment that's hostile to cancer stem cells. Next, the protocol often incorporates compounds that directly support mitochondrial health. These might include coenzyme Q10, L-carnitine, and even certain polyphenols from green tea or turmeric, which have shown promise in lab studies. The idea is that by fortifying the mitochondria of healthy cells, while simultaneously undermining the survival mechanisms of cancer stem cells, you create a dual-front strategy against cancer. And let's not forget the supportive role of lifestyle and diet. A nutrient-dense diet, regular physical activity, and stress management can all bolster mitochondrial function. This integrative approach not only helps in potentially reducing the risk of cancer progression, but also improves overall well-being. Of course, while the theory behind the hybrid orthomolecular protocol is promising, it's important to acknowledge that research is ongoing. Early studies and clinical observations suggest that targeting the mitochondrial stem cell axis could enhance the efficacy of conventional treatments. However, more large-scale trials are needed to confirm these benefits and to standardize treatment protocols. For clinicians, this means staying informed about emerging research and considering integrative approaches that complement existing treatment plans. For patients, it offers hope that future therapies may be more personalized and effective by addressing the root of treatment resistance. One of the most exciting aspects of this approach is its potential to bridge the gap between traditional oncology and nutritional medicine. By harnessing the power of natural compounds alongside conventional therapies, we're looking at a future where treatment is not only about killing cancer cells, but also about restoring balance to the body's intricate cellular networks. Although much of the discussion is rooted in complex biochemistry, it's the human stories behind the science that truly resonate. Patients who have integrated aspects of orthomolecular medicine into their treatment regimens have reported improved quality of life, reduced side effects, and in some cases, better responses to treatment. It's important to stress that these integrative approaches should always be conducted under the supervision of qualified healthcare professionals. Every patient is unique, and what works for one might not be suitable for another. Personalized medicine is the future, and the hybrid orthomolecular protocol is a step in that direction, tailoring treatment to the individual's biology, not just the disease. In summary, targeting the mitochondrial stem cell connection in cancer treatment with a hybrid orthomolecular protocol represents a promising frontier in oncology. By addressing the metabolic quirks of cancer stem cells, this strategy may enhance the effectiveness of traditional treatments and open new avenues for personalized medicine. As research progresses, we may soon see more integrative, multifaceted approaches to cancer therapy becoming mainstream. It's an exciting time for both clinicians and patients as we look forward to a future where the synergy between nutrition, biochemistry, and conventional medicine can deliver more targeted and effective care. Thank you for tuning in to this deep dive into the mitochondrial stem cell connection and hybrid orthomolecular protocols in cancer treatment. We hope you found the discussion as enlightening as it was thought-provoking. That wraps up this episode of MedHeads. Remember, the insights shared here are part of a broader conversation in integrative medicine, and we're here to keep you informed on the latest advancements. This podcast is created by meducate.com.au, where you can find courses and content for health professionals. Stay curious, stay informed, and we'll catch you next time on MedHeads.